I'm Dr. Randy Fink. About 1 in 5 women suffers with heavy menstrual bleeding, so let's talk about some of your options for treating it. Some people prefer to take a medication such as ibuprofen, which when taken during your menses may decrease the amount of menstrual bleeding you have by about 25%. Another option is hormonal birth control, such as a birth control pill or the NuvaRing. Birth control will give you a regular, predictable monthly period that's shorter and lighter, and most of the time gets rid of the other menstrual-related problems like PMS and menstrual migraines. Another option is an IUD, or an intrauterine device. The one we use now you may have seen advertised on television. It's called Mirena. Mirena thins the lining of your uterus, or the endometrium. With a thin lining, sperm can't swim around on the inside, and this is how the IUD functions as birth control. But one of the side effects from that thinning is a 90% reduction in your menstrual blood flow. The IUD can stay for 5 years. Perhaps the greatest advancement in the treatment of heavy menstrual bleeding is a procedure called an endometrial ablation. An endometrial ablation is performed here in the office and does not require general anesthesia. In fact, most of the time we chat comfortably through it while we listen to music and watch the process on the ultrasound. The endometrial ablation treats the lining of the uterus such that there's just nothing left to slough off at the end of the month. Your hormones are unchanged, and the result is that about 50% of women will stop having periods entirely, while the other half usually have either a day or two of spotting or a little short, light, even normal period. We've performed thousands of these procedures, and the success rate is really about 99%. So, if heavy menstrual bleeding is something bothering you, why not give us a call and let's see what we can do to help.